Good morning. Thanks for joining us live on this month's edition of Ask the Mayo Mom. I'm Dr. Angela Mattke, and today we'll be talking about pediatric kidney-related issues. I am a general pediatrician at the Mayo Clinic Children's Center in Rochester, Minnesota, and I'm also a mom to two active, healthy little boys. Each month we have a specific pediatric related topic, and I also usually bring in a guest lecturer to give us some information more about those topics. We like to take your questions throughout the live session, so please send your questions in, specifically today about pediatric kidney related issues, but we'll also try to answer any other issues you may have. Send those to the Mayo Clinic Facebook page under the Facebook live stream. So let's move on to introducing this month's guests. I have Dr. David Sass here with me, who is a pediatric nephrologist, which is a kidney doctor related to children. And he treats kidney-related to issues for all children related issues. So can you tell us a little bit about yourself?
Sure. So first of all, thank you very much for having me. Yeah. I am a pediatric kidney doctor, and so how one becomes a pediatric kidney doctor. First, I trained in general pediatrics. So I did 3 years of general pediatrics training, just like you did. Yeah. Then I did 1 year as chief resident. And then after that, I did a fellowship in pediatric nephrology. And those fellowships are 3 years. So that's what it takes to become a pediatric nephrologist. And then I've been taking care of kids with kidney disease ever since. I think kidneys are the most important organ, and I think nephrology is awesome. So yes. I'm happy to talk about whatever you'd like.
Okay. Amongst pediatric specialists, there's always a debate going on about which organ is the most important. So
the answer is the kidneys.
Obviously, the answer today is the kidneys. Next month, it might be a different organ. So do you have a specific area of interest in amongst kidney-related issues in children?
Right. So while we all pediatric nephrologists take care of kids with all sorts of kidney diseases, my special area of interest is in pediatric kidney stone disease. Okay. So hopefully we'll get a chance to talk about that because I really get excited to talk about pediatric kidney stones.
Awesome. Well, let's start with some basic information. I think to talk more about the kidneys today, I think we need to understand what their role is and what they do. So can you tell us a little bit about what the function of the kidneys is?
Sure. Okay. So almost all people have two kidneys. And they have two main jobs. Okay. The first job is to get rid of water we don't need, and the second job is to get rid of chemicals we don't need. The water and chemicals that we don't need together is urine, or pee. And they have two other jobs that they help maintain our acid-base balance, which is really important, and then they also produce certain hormones that are important for us. But getting rid of the water and chemicals is the primary job.
Okay. So you said most people have two kidneys, and some people maybe have one. Can you live without your kidneys?
So, well, if you only have one, you're fine. The system is born with some redundancy, meaning that you don't need all of your kidney function to live and thrive and grow, but you do need some kidney function. So for the question, can you live without your kidneys? Well, no, you can't. However, fortunately, scientists have developed dialysis. So if your kidneys shut down completely or get down to a level where a child can no longer grow and develop, then we can do dialysis until we have a chance to either help the kidneys heal or get them to a transplant.
Okay. One question as a general pediatrician we get a lot when we're doing sports physicals is can kids participate in sports with just one kidney? What is the answer to that?
Yeah, so the answer is different today than it was 20 years ago. Okay. So 20 years ago, if your doctors figured out your child had one kidney, they would say no contact sports because the risk of trauma to that one kidney is too high and you could lose it. And if you only have one kidney and it gets injured, well, then you're out of luck. Well, fortunately, they've actually done some research on that and figured out that kids with one kidney are at no higher risk for trauma than kids with two kidneys. And that therefore it is not, having only one kidney is not a reason for a kid to not participate in any sport they want to. As one thing we always like to point out is you only have one brain, we still let you play sports. You only have one heart, we still let you play sports, right? Those are pretty important organs. Not as important as the kidneys, but important. So nowadays we let kids participate in whatever sport they want, whether they've got one or two kidneys. We do sometimes caution parents if you're looking for a reason for your child to not play tackle football, it's not because of the kidneys, it's because of the potential risk for catastrophic head and neck injury, not the kidneys.
Okay, thanks for answering that question. So let's move on to talking about kidney stones. You mentioned that they are one of your passions, one of the things you were hoping we'd talk about today. Can you tell us what are kidney stones and why are they a problem?
So kidney stones are the product of unfortunate urine chemistry. So kidney stones form when a combination of environmental things in the urine happen. When you've got too high a concentration of different minerals, first they form tiny little crystals, and then those crystals get together and form stones, which can grow and grow and grow. So everybody is born with the genetics that they get from their mom and dad, right? So everybody is born with a genetic predisposition to either form stones or not form stones.
Okay.
Some people have to work very hard to form a kidney stone. Some people have to work very hard to not form a kidney stone. So you have your genetics, and then on top of that, it's how you interact with your environment, which determines whether or not you will form a kidney stone on that day. So, and when I say how you interact with your environment, I mostly mean what you eat and what you drink.
Okay. All right. So we hear a lot about kidney stones in adults, I feel like. But are kidney stones something that happens in children frequently? Is it increasing? I seem to hear more about it in the last couple of years.
Yeah, so kidney stone disease, as you mentioned, used to be a disease of adults. Kids almost never got them. For some reason, in the last 15 or so years, we're seeing a big increase in the incidence of kidney stones, and we don't really know why. And that's one of the questions I'm hoping to answer through my research. It probably has something to do with the way our children's diets have changed. A lot of people suspected obesity might be related just because the rise in kidney stones was happening at the same time as the rise in obesity. But there have been a number of studies that we've done that suggest that obesity is not the problem. In fact, our kidney stone formers tend to be skinnier than our non-kidney stone formers. So we're not sure why it's happening, but we know it is happening, and we know it's a problem. And where, if you talk to an ER physician or a family doctor who's in his 50s or 60s, he or she will say, boy, I never saw a kid with kidney stones before, and now I'm seeing more and more. So it's a big problem, and we're working hard through a number of different research efforts to try and figure out why it's happening. In the meantime, there are things that we know about how to prevent them.
Okay. What are some of those things?
So there are two things that are true of all kidney stone formers, no matter what type of stone you're forming. One is the more water you drink, the less likely you are to form stones.
Okay.
The second is the less salt you eat, the less likely you are to form stones. So water prevents stones, salt seems to cause them to form. Beyond that, what's really important in terms of prevention is figuring out what your individual urine chemistry is. So what I mean by that is we can do tests on kids' urine to figure out the details of what's going on in there and why that particular kid is forming a stone. So the most important thing I would say is that if you have a child who's having kidney stones, that you or an adult, that they get a comprehensive evaluation by someone who is an expert in kidney stones. So usually that involves a multidisciplinary team, or I should say ideally it involves a multidisciplinary team with a nephrologist, perhaps a urologist, and often a dietitian. Okay, so having someone who is there's no one size fits all. Kidney stones are something that are really specific to the individual and require an expert to take a look at exactly what's going on in each kid, so we can figure out how to treat them best.
Okay, so you mentioned a urologist, a nephrologist, and a dietitian. And we have a question that says, does diet really make a difference in producing kidney stones? So what is the dietitian's role, and what is the role of other things besides water and salt in the diet?
So once we have the 24-hour urine collection, then we can see what contributing factors that individual has. So for some people, they have too much calcium in the urine. Some people have too much oxalate. Some people have too much uric acid. They're all different things that can contribute to it. And so you need to know those details before you can come up with a strategy. So again, we will always talk about water and we will always talk about salt. For some patients, we need them to eat a diet that's lower in oxalate. But beyond that, we really need to know the details. There are some, so some questions have come up about coffee. there is some loose evidence, I would not say it's hard evidence, but there is some loose evidence that coffee is protective against kidney stones. But that doesn't mean go out and drink 10 cups of coffee.
Oh, shoot.
And oh, by the way, it does not mean children should be drinking coffee. So, but generally you want to avoid drinks that are high in sugar. There is some evidence that high fructose corn syrup contributes to stone disease. Again, that evidence is kind of shaky, but it's out there. So yeah, I would say broadly, a generally healthy diet is good for preventing kidney stones. Lots of vegetables and lots of water.
Okay. So how would a person know if they have a kidney stone? How would they know their child has a kidney stone?
Right. So in adults, the adults classically present with this one-sided, severe, worst pain in your life, lower back pain, and often nausea or vomiting, and often blood in the urine. Okay, so that's the classic presentation, and most adults present that way. Children tend to be a little trickier. They tend to have a wider variety of presentations. Sometimes it can be that classic one-sided low back pain, but oftentimes it's just abdominal pain. So if a kid has really severe abdominal pain, severe back pain, blood in the urine, those would be reasons to suspect a kidney stone. And you might have to remind your primary care doctor or your ER physician, if you're a parent bringing your kid in, you might want to say, could this be a kidney stone? Because it's, as I mentioned, it's not on everybody's radar screen yet, and it should be. So, and the way it gets diagnosed, if it's suspected, it's with imaging. So depending on where you are, they will either use an ultrasound or a CT scan to try and diagnose the stone. Is
one modality for imaging, so ultrasound versus CT, is one of them better for children?
So that's very controversial. If you go to the big kidney stone meetings, you'll get doctors yelling at each other and arguing about which is the most appropriate one to use. Right. Nephrology, we get very passionate about this stuff. So the short version is that CT scan is better at finding the stones compared to ultrasound. But CT is more expensive and it exposes the child to radiation, which we don't love. Ultrasound is a little bit cheaper but doesn't expose to radiation. So there are pros and cons to each. I generally will start with ultrasound because, of course, here at our institution at the Mayo Clinic, we have outstanding equipment and outstanding technicians and radiologists. So I trust them even with ultrasound to find even the tiniest of stones, but other places might not have that benefit. So it's really up to the physician to know which is best. Sure. But either one is a great place to start.
So if your child's getting one of these modalities, one of them versus the other, either one is fine. There's not necessarily a right answer per se.
Right. Now, so if a kid has, classic kidney stone pain and goes and gets an ultrasound and the ultrasound doesn't show a stone, they might then go to a CT because it just, the clinical picture just looks so much like a stone. They say, there's got to be one there.
Right. So. And confirming that diagnosis might actually change what the management is in the child, right?
Absolutely, yeah.
So what is the management? How do we treat these kidney stones in kids?
So acutely, when they are having the kidney stone event, depending on how severe it is, sometimes they need to get a pediatric urologist involved, which is a surgical specialist who deals with the kidney and urinary tract. And sometimes they will need to do a surgical intervention to remove the stone, or they can blow them up with lasers. They can do all kinds of cool stuff. So that's sort of the more emergent, acute management. And one thing I should emphasize is that if a child with a kidney stone who also has a fever is a true emergency. That's very dangerous because sometimes the stone itself can harbor bacteria and become infected, and that can be very hard to treat with antibiotics and can cause big trouble. So kidney stone plus fever is a true urological emergency. So anyway, so that's if something's very severe, they'll call the pediatric urologist. Otherwise, it's about hydration and pain control. So the ER will often put an IV in the child and give some IV fluids as well as IV narcotics or anti-inflammatories to help quiet things down. And then there's also a medication that can be used to help ease the passage of the kidney stone.
Okay. Once the kidney stone passes, is it helpful to actually catch that kidney stone and send it for analysis to see what it's made of?
Yeah, that's super helpful. And we often don't get them. Oftentimes the parents don't know or weren't told that they're supposed to collect it, and so they flush it down the toilet, and we miss an opportunity to really get some insight into that patient's urine chemistry. So it's very helpful to hopefully what the ER will do is have the child pee through a strainer so that the urine can pass into the toilet, but it will catch any stone, and then we can analyze that stone and get more information.
Okay, sounds good. How about, what can we do? We talked a little bit about prevention, but we have one specific question about someone who forms oxalate stones. Is there anything specifically that can be done to prevent oxalate forming stones or the calcium phosphate stones?
Right. So the most common types of stones are calcium-based stones, and then you can break that down to calcium oxalate, which is by far the most common, and then calcium phosphate, which are a little less common. And really, it depends. We need to know more about the urine chemistry. It's hard I can't just say, oh, this is how you treat calcium oxalate stones, because there are oxalate stones that are the result of your digestive system absorbing too much oxalate, and then there are also genetic contributions. So here at Mayo, we're the home to the Rare Kidney Stone Consortium, which is an international group of researchers that has a special interest in genetic forms of kidney stones, including oxalate stones. So we do a lot of research about that here. But so we can help figure out, is this a genetic thing or is this a dietary thing? If it's a genetic thing, the diet's not going to matter very much. So it's important to delineate that, because we don't want to restrict a child's diet unnecessarily, right? We don't want to say, oh, you have calcium oxalate stones, you should limit your oxalate, because guess what? Oxalate's in a lot of foods that are really good for us, a lot of green leafy vegetables and spinach and stuff like that. So we would hate to limit that. So again, it's just really important to have a comprehensive evaluation.
So to answer that question, just to summarize it up for that person, it's an oxalate stone former. So it's really going to depend on your specific urine chemistries and your genetics. So speaking to your nephrologist, but probably the most helpful way to go about it. In medicine, we like to say things like, when you've seen one child with kidney stones, you've seen one child with kidney stones, because every single child can be different with what they bring to the table with their genetics and stuff.
Yeah, so my advice would be to go have a comprehensive evaluation that includes, most importantly, a 24-hour urine test. That's the most important test that we can do to help.
Okay, sounds good. Well, that was really helpful. Is there anything else you want to add about kidney stones?
Oh, I could talk all day, but I know there are other topics that people might be interested in, so we can move along.
We'll move on. Let's move on to talking about urinary infections in children. So we call those UTIs. And I think as a general pediatrician, this is probably one of the most common reasons I see kids related to their kidneys or their bladder and their urine. So how frequently are urinary infections, do they occur in children?
So somewhere around 10% of children will have a UTI at some point during their childhood. Okay. It's one of the more common infections, and in the infant period, it's the most common form of serious bacterial infection.
Okay. Do the way that a urinary tract infection symptoms would present in a child, is it different in younger children as opposed to older children, or is it pretty similar?
Yeah, so younger children will often, babies will present simply with fever and perhaps irritability, vomiting. They're just sick and not feeling well and have a fever, whereas in the teenage years, kids will often have simply just burning with urination. Okay. So as kids get older, they may be urinating more frequently, and they may complain that it burns when they urinate.
Are urinary infections in younger children more rare than infections in the urine of older children? Is it something we look at more closely if a young child gets a urinary tract infection?
Yeah, so when the trouble is with children is they can't tell you exactly what's going on. Right. So a 4-month-old is not going to tell you it burns when I pee. Right. So therefore, we usually identify them as sort of when we are broadly trying to diagnose what the problem is. So, but one thing is true, is that all urinary tract infections should be diagnosed with a urine culture. Okay, and this is an important point, is that it is not, even in a teenager, I don't think it's acceptable to just see a teenage girl with burning in her urine and give her a prescription for an antibiotic because you think it's a UTI. the proper way to do things is to get a culture, because then you can confirm or deny the diagnosis, and you can figure out what the bacteria is that's causing the problem and what's the most appropriate antibiotic. We have a big problem in the country and in the whole world with antibiotic resistance.
Right.
And if you're just sort of blindly treating infections without really focusing on the proper antibiotic, you're contributing to that. So getting a culture and figuring out what the bug is that's causing the problem, and then treating that specific bacteria is really important.
So a lot of times the symptoms of a urinary tract infection can be other things. And some of those other things would be like sexually transmitted infections in teenagers. What are some other things that could kind of present that way?
So sometimes kids can have too much calcium in their urine, can cause crystallization in the urine that might not lead quite to stones, but it irritates the urinary tract. So that can lead to blood in the urine and pain. But one thing that's important to know is, a lot we'll have patients come in and complain of kidney pain. Kidney pain, actual pain from the kidneys, is really uncommon. There are only a few things that can cause kidney pain, because the kidney tissue itself doesn't have pain receptors. So kidney stones, where that pain is actually not coming from the kidney, it's coming from the ureter, the tube that connects the kidneys to the bladder, that skinny little tube. When a stone gets in there, that causes pain. An infection that has reached the kidneys, we call that pyelonephritis, that can cause kidney pain. If a kid has kidney cysts, that can cause kidney pain, or if there's some blockage and obstruction, that can cause kidney pain. Other than that, kidney disease in and of itself doesn't hurt. Okay, which is a good thing, but it means it often goes undetected.
Right. Okay. Are there certain conditions or anatomical abnormalities of the kidney or just the urinary system in general that could predispose a kid to having more frequent urinary tract infections?
Sure. So any anatomical difference from normal, puts you at higher risk for having a urinary tract infection. So the greatest defense that we all have against forming UTIs is good urine flow. So drinking lots of water and keeping the urine flowing washes those bacteria away. If you have slight little differences in your anatomy, that can cause turbulent urine flow or urinary stasis, meaning where it's just sitting there. So any anatomical problem can increase your risk for UTIs. Now, the other important thing is proper bladder emptying. So often under-recognized problem is what we call dysfunctional voiding, which is our fancy way of saying not peeing right. So a lot of kids will develop unhealthy urinary habits, and this is super important because it's easy to identify and it's easy to fix over time. So I'll have a lot of kids who have recurrent urinary tract infections who I find out are only peeing once or twice or 3 times a day, and that's terrible for your kidneys. It's bad for your bladder. So that urine just sitting there becomes a welcoming environment for bacteria to grow. So once we identify, so these are kids who are waiting too long to urinate. They often do the pee-pee dance, and they often will have little accidents in their underwear during the day. Those kids are the ones who are not urinating frequently enough. The second problem is they are not completely emptying their bladder when they go. So you can identify these kids because they're the ones who will go to the bathroom, and then they'll go back to playing, and then 10, 15 minutes later they go back and they go to the bathroom again. So if you completely empty your bladder, you should not be peeing again in 10 minutes. If you are, that means you didn't let it all out. And again, that just grows bacteria. So, and then the final part of it is that, as we say, dysfunctional voiders are always dysfunctional poopers. So they're almost all constipated.
That's very true, yes.
There are a million different definitions of constipation, but my definition is I want all my patients to have 1 large soft stool per day. That is helpful to keep the urinary tract flowing nicely. Constipation, that ball of stool sitting in there can affect urine flow. So we want our kids to be peeing frequently enough, and we want them to completely empty their bladders, and we want them to be pooping normally, and that can go a long, long way in preventing recurrent urinary tract infections.
So related to just general good kidney health and good kidney hygiene, how frequently should a school-age child be voiding during the day?
So school-age kids should be urinating every 3 to 4 hours during the day. Okay? And we often have complaints from parents that the schools don't allow their kid to drink water or use the restroom frequently enough. So we often will write prescriptions to say this child needs to have free access to water and the restroom. Ask your doctor for that. We do it all the time. And another important point I want to mention is that once you get out of infancy or early toddlerhood, boys should not get UTIs. If you have a boy who is 5 years old or 8 years old or 12-year-old who gets a UTI, that child should have imaging to look at the anatomy of their urinary tract, because it is very likely that that boy has an anatomical problem, because boys just don't get UTIs once they're outside of infancy unless they have an anatomical problem that really should be addressed.
Okay. What about how much should kids be drinking per day? So like an average 10-year-old kid, like what's the amount of fluid if you had to give a number to it? I think parents ask me that question a lot.
Yeah, so every kid is different, and obviously the kids who have kidney stones or UTIs need to drink more water. But for a school-age kid, like a liter to a liter and a half is reasonable. Once you're into adolescence, at least a liter and a half to 2 liters. And but that's baseline. Okay, if the kid is an athlete and playing sports and sweating, then they need to take that into account and drink a lot more.
Absolutely.
Yeah.
I tend to say I want your pee to always be clear.
Yep.
And you should be peeing at least probably about 4 to 5 times a day minimum, if not more.
Yeah.
If they're awake for at least 12 hours during the day. So.
Yeah, one of the things I recommend often for my certainly for my stone formers, but for other kids as well, is to sleep with a nice tall glass of water or a bottle of water next to your bed. And when your alarm goes off in the morning and your feet hit the ground, the first thing you do is chug that glass of water, because the morning is sort of the time when you're most vulnerable, because that's the longest period you've gone without drinking. And so your urine is very concentrated and all those crystals are getting together to cause trouble. So a nice tall glass of water can flush that away and set you off on the right foot for the day.
Okay. Well, we are nearing the end of our hour. This has been really informative and fun to have you here today.
That went fast.
It did. It did.
I could talk about kidneys all day.
We only have about 30 minutes for our show, so maybe we'll have you back on another time and we can talk about some other things or more about kidney stones.
Sure, I'd love it. Thank you so much for having me.
Yeah, thank you. So join us next month. We're going to be having on our pediatric urologists, 2 of them here at the Mayo Clinic Children's Center, Dr. Candace Granberg and Dr. Patricio Gargola, and they will be joining me on August 18th at 10 a.m. For the next edition of Ask the Mayo Mom. Thanks for joining us today, and if you have any other questions, you can send them to the Mayo Clinic Facebook page, and we'll try and answer them offline. Thanks, and have a great day, everybody.